might have been following the story out of Tennessee where several people were injured after receiving IV potassium into their epidural instead of an anesthetic. But obviously, this is a horrible situation for everyone involved. However, if there is one piece of silver lining to this, it's that a sentinel event like this, so when somebody is harmed either permanently or catastrophically, accrediting bodies like the Joint Commission require that something called a root cause analysis, or RCA, be done to investigate how the error happened and the events that led up to the error happening, and basically initiate a blueprint for change as far as how to prevent them from happening again. This obviously is good for the hospital where it happened, but things like this that gain national attention, of course, will initiate change for other hospital systems and practice settings in order to prevent that error from happening to them. I saw several comments on videos about this where people are like, I hope that person that made the error is fired, and that's exactly what a root cause analysis is meant to prevent the trap or the error that happened from happening again. Because if you fire one person because they made a mistake, you have to look at all the things that led up to how that person made the mistake. So were the packages stocked next to each other in the pharmacy? Was the labeling identical on the packaging? So that's a manufacturer issue. Do we only have one person working overnight and they're overworked from all the other orders that are coming in? Do we need better staffing models? There are so many things that could have led up to this event, and a root cause analysis is meant to look into those things in order to give a plan to prevent it from happening again. Hospital or essential pharmacy are literally the heart of the hospital. They touch every medication that goes into the hospital system, whether that's in the OR, on the ICU, within the discharge pharmacy, if they have one. The hospital pharmacy, the techs, the pharmacists, they are responsible for all of the medications in the hospital. So it is a very high stakes environment. There are many players and moving parts. I'm not excusing this error from happening, but I'm just saying that there are always ways to improve to ensure patient safety. If anything, at a time like this, it's best not to try to place blame and point fingers, especially as the public who has no direct involvement with the situation. If anything, just keep the people involved in your thoughts and keep the patients and their families in your thoughts and hope for the best outcome for both.